Hey everyone, I hope all is well. My name is Lexi Grundon and I had chapter 18, which covered accreditation. So let's get started. So, first off, let's ask ourselves, what is accreditation? Well, accreditation is a formal declaration of designated authority, a basis for quality improvement process and initiatives. And applications for accreditation include, for example, in industries, it would be organic food, for institutions, it would be education, and lastly, for products and systems, an example would be software and laboratories that need to be accredited. Accreditation in healthcare industry is very important now, especially with everything that's going on with COVID-19. It is found extensively in healthcare across the globe, um, which can differ, and we'll get into that later in the presentation. It is common in acute care hospitals, general practice, aged care public health. It includes specialist services, for example, tissue banks. Self governing organizations. So, accreditation agencies, including stakeholders, now constitute a self governing system. This system focuses on both attitude and practices of all parties in the accreditation process. Common standards, understanding, and reinforcement of same are the goal of these self-governing organizations. And this international focus is directed through the ISQUA, or International Society for Quality and Safety in Healthcare. So, commonalities and differences. The common accreditation model is a model where the organization conducts internal processes, reviews, and documentation, and then seeks out formal review. Another way is the reviewing agency sends in a survey team who report back findings. Now, this survey method can have some difficulties. The questions that are included in some of the surveys may be skewed a certain way, which may lead the surveyor or the person taking the survey to answer in a way that this agency wants them to. It also could create biases with if you know the person who is surveying, if you have any personal relationship with a company, that can give bias. So that is a difficulty with um, the survey team. Accreditation agency reviews findings and issues, and if they are up to standard, you will be accredited for a finite period, so usually 3 to 5 years, and then the cycle will renew. Accreditation standards. These standards will cover infrastructure, organizational, service, and patient care issues. So it's kind of a well rounded thing that they look at. They're developed with stakeholder input, and surveys are conducted against local standards. Now, these vary internationally, which I thought was very interesting. Each country tends to have a differing set and number of standards. For example, Canada has 30 that you have to go through, and whereas France only has 13. So it is very important to be up to date going into healthcare. You should know all the international standards to better round yourself with what is happening, not just with US healthcare, but all around the world. So, evidence base for accreditation. In spite of global expansion, the evidence base remains underdeveloped. Growth in accreditation requires more research to build the internal and comparative research base. Systematic literature reviews are one important evidence source at this early stage. For example, in 2008, Greenfield and Braithwaite um, produced some literature reviews that helped with accreditation. Outstanding research issues include consumer reviews or patient satisfaction, public disclosure, and surveyor issues, as I had mentioned before. The relationship between accreditation and quality measures is still unclear and understudied. Main evidence types are document analysis, observations, and interviews. Outcome strategy of accreditation. Now, studies have shown that accreditation improves the overall quality of care in healthcare facilities. In certain specialty areas, accreditation programs even improve patient outcomes. This also improves the quality of care by decreasing variations in the ways different staff members and departments care for patients. So, it is very important. Now, let's look at the pros of accreditation. Some pros include it is better to identify their strengths and weaknesses through this accreditation process. document their capacity to deliver the core functions and 10 essential public health services. It promotes transparency. It improves their management processes and stimulate quality improvement and performance management. Now let's look at some issues and challenges of accreditation. Do you do voluntary or mandated accreditation programs? Do you do rigidity or flexibility of accreditation programs? The financial cost to address quality and safety issues. Some standards are the role of process and quality indicators to foster improvement, and surveyor workforce sustainability, role, and reliability. These are all issues that could come with accreditation that, since it is understudied, which way is the right way is still unknown. So future research needs to go into the proper way to do a accreditation process. So in conclusion, accreditation is now both instituted and institutionalized. The value of accreditation is a mixed and incomplete picture. The evidence base requires considerable development and expansion. The challenges identified are substantial but actionable. So, with that being said, more research needs to be put into accreditation so we can have safer hospitals and a higher quality in our healthcare, not in just the US, but all around the world. Thank you so much, and I hope you guys are all well.